Yeah, Julie Marie-Corbelli again. I wonder to all of you whether you have some data about the opposition that usually are raised against PrEP. For example, the raise in STIs diagnosis, stuff like that, or other usual myths raised against PrEP that can be addressed by your own national experiences.
Yeah, I can. I don't know. Just for. Okay, let's see if it works. As for prevenir, for example, we are not observing at all an increase on STIs. Yes, we are conducting more. We are running analysis, and we will have more complete data, but it's not the case.
That was raised as a concern for decision makers in Scotland, and at the same time, some data from Dean Street, I think, came out showing that there wasn't an increase in STIs, so we just pushed that heavily.
Yeah, from Norway, we have had it now for a year, so we can't really see if there is like an impact of PrEP on other STIs, because the number that we now have, 700, it's been like increasing slowly over a year. So we see increases in other STIs, but for example, we can see from gonorrhea numbers that they have been rising for the last 5 years. So.
When it comes to Belgium, there are no general figures for STI, but in a demonstration study, no rise in STIs were noted. But then again, the group who takes part in the demonstration study was already a group who was extremely high in STIs, but with them there was no rise.
And also HIV is an STI, and we have seen a drop in new incidence rates of that STI, so...
And everyone expects them to rise.
And hopefully, when people are uptaking PrEP, more people will also then use the occasion to have an STI screening and go for treatment. Thanks. Any more questions?
Yes. Hi, my name's Jackie Stevenson. I'm with the Sophia Forum in the UK. I think we heard in a few of your presentations that the number of women accessing PrEP has been really quite low, and I just wondered if the panel had any reflections on what the barriers are, any steps that you've done in your own work that have or haven't been effective in engaging women, and what we can do to make sure it reaches the people that need it.
So our steering group looked at what are the possible presentations that cisgendered heterosexual women would have for asking for PrEP, and they found that difficult to conceptualise. It tends to usually be when they're in a relationship with a serodiscordant, detectable positive person. In Scotland, we wouldn't typically give PrEP to someone in an undetectable serodiscordant relationship. So that's the priority usually, and normally those are very easy responses to make. But more broadly, we've done quite a bit of workshops with heterosexual women from some of our key populations and trying to identify barriers for them. Some of them tend to be the response from the healthcare system is always adequate, but it's cultural, community and stigma is the main thing. And so there's a series of interventions I can talk to you about more a bit later. But yeah, that's our approach.
It's a bit too soon to have some research on it, but from what I've heard from the staff that works in the PrEP hours where the consultations are happening, they see mainly white, middle-class, 40-something, middle-income men. That is the profile. And other than those, other risk groups like migrants do not find their way yet to these provisions. Again, it's still too soon also to already have campaigns in order, so we haven't prepared for that yet.
Well, in Norway, it's similar to Belgium actually, but they're like on paper, PrEP is available for everyone, but in praxis, it's actually just pushed out towards MSM. But there hasn't been any funding for any public campaign on PrEP in Norway. It's been driven by HIV Norway and the civil society.
And then I'm going to repeat the same thing. There is no communication addressed to women. There are no NGOs working with women that are really with us working. So they have to come to us, and we have to improve our way to go to them. So.
Thank you. We continue with a question from...
Sorry, quick question.
from
Congratulations to the panelists. Congratulations to your countries. Quick question. Regarding the kind of discussions on around reimbursement, because each of you have sort of mentioned you had set up a task force, some type of working group in sort of the lead up to the announcements and actual kickoff for full PrEP access. Were those reimbursement discussions done is sort of behind, sort of within the context of those task force working groups, or just executive decisions? It'd be nice to get a sense, how that was done.
As for France, what I can say is that it's our French specificity that has done that. It wasn't even an issue. It wouldn't be possible to have a drug use that is not paid by the state. So once we accept having PrEP, it's fully reimbursed.
Yeah, it was all in on full reimbursement. I don't think it would have been acceptable for anyone if it had been a co-payment on that.
Yeah.
Scotland only provides drugs completely subsidised, so there was no question of that, and all of those discussions were done in the working groups quite openly. There were no behind doors executive decisions that I'm aware of.
And in Belgium, it was very much an executive decision. We were not involved in discussions around it, and we received the final outlook of the policy.
Thank
yes,
you.
can I?
Next question.
I'm nervous. Daniela, your English is much better than mine. My questions, tomorrow I will represent Ukraine and PrEP project in Ukraine. And we have one point, like it's our difficulties. So when person give analysis to like blood analysis, then a person must wait like 9 days to have results. So we have like big time between first visit to hospital and last visit. And for our opinion is like do adherence to PrEP, like sympathy to PrEP, taking pills, like lower. Adherence, it's mean person won't take PrEP or no, and this zone is like do his wish less. So can you say about some kind of fast track in your countries and adherence to PrEP with a fast track?
So in Scotland, our adherence that I'm aware of from the data I've seen is very high. Only a few people have not remained on PrEP. And in terms of, it's out with my expertise to talk about expediting things and when you should get someone started on PrEP depending on when their last test was. But I know there's a lot of stuff out there, and I don't know if that'll be covered later in the sessions.
But I mean, can it be 1 day? So person go to hospital, half hour, in 2 hours he has result and take pills.
So I'm looking for Gus to say, I know there's a lot of stuff on that, but I don't know the answers to that. So is that being covered later, or...?
It isn't necessarily being covered later, but I can say as someone involved in the PROUD study that PROUD took the highly controversial decision to basically give people their PrEP the day they took their test. And as a result, there were a few people in PROUD who later on turned out to have HIV. Some of whom were basically already positive, well, all but one of whom were basically tested positive the day they started taking their PrEP, one of whom only became positive a month later. And that was quite controversial. But the reason they wanted to do it that way was because when do you start? If somebody is very highly at risk, if you wait a week, they could catch HIV within that week, then you have to do another test. What is the point? So I think you just have to say, okay, we give you a test, we give you your pills. If you turn out to be positive, we'll ring you in a week's time and say, come in and start on another drug.
Thank you.
Hello, I'm Elske Hornborg from Amsterdam here. from your experiences, what do you know about preferences of gay men regarding location where they can get their PrEP? Some of you have hospital-based programs, others have STI clinic-based programs that would really help implementing discussions.
In France, what we have observed is that it's equally share the preference. So, gay men want to go to community-based organization and to GPs, and then hospital are the last option. And we are doing exactly the opposite.
Yeah. Well, just before 1st of January, you could actually choose in Norway if you wanted to use your general practitioner or you wanted to go to a sexual health clinic or to your local hospital where there is an infectious disease specialist to get a prescription. Now, because of financing, you have to go through a hospital either way. They are working on some practical solutions so you can actually go still to your GP, but the prescription has to be from an infectious disease specialist in a hospital. So it's just like, it made it difficult.
We've been providing PrEP for a little over 6 months, and it's always been through sexual health clinics. Our sexual health clinics are at capacity, so we have some real resource challenges there because also they're competing against women who need reproductive health support, and so we do need some solutions there. We don't have a comparison at the moment of other ways, but we know there's appetite for looking at community prescribing and digital prescribing as well, but we haven't implemented anything like that yet.
In Belgium, there are no community health centers, and actually in the PrEP guidelines says that the only place where you can get your allowance to use PrEP or get it reimbursed is after visiting a AIDS reference center. There are 5 AIDS reference centers in Belgium, and all renewals of prescriptions need to be done there as well as all the testing. As these centers not only work for PrEP, but they are AIDS reference centers, they do also all the following up for people living with HIV, and then have to take in all this extra PrEP work. My guess is that after a couple of years of this experience, probably GPs will also start playing a role in it, that the initial allowance comes from an expertise center, and then the follow-up is done by GPs. But
and what do the MSM think of
what do MSM think of it?
The AIDS reference center?
It hasn't been asked, but in general, as Belgian medical practice is strongly based on GPs, and there is a strong most gay men in other studies have indicated that they have a good understanding with their GP. I suppose that if the GP could be taken into the practice, this would be something that could really work.
We are in danger zone now. I thought we were doing quite well on time, but Gus warns me that we will lose our coffee if we are not stopping soon. So I think there are 3 people I can see who have questions. If you can have a very short question, and if we have one of you respond to each of the 3 there, so maybe we can make it.
I'll try. I'm Emmanuel from Germany, and I wanted to ask, until PrEP, what was the state of coverage and capacity for STI testing in your country? I'm asking because in Germany right now, even though the user pays for his own pills, the issues we're having are all having to do with the STI testing around it. The price of it can go from 0 to a whopping 900 euros per 3 months. And also we have clinics that turn away people who are interested in PrEP because they say, we don't have capacity anymore, we cannot take new PrEP patients. So I wanted to see what we perhaps could learn from your side.
Thank you for a very important and rather short question. Any of you who would like to say something to this shortly?
Okay, so your key question is about Before PrEP?
Before PrEP, if I went to my doctor in your country and said, I want to get tested for STIs every 3 months, what would happen?
Very straightforward. You can get tested regardless of your gender, sexuality, or whatever. You can get tested for any STI. You don't pay anything for it. It's paid for by the state. The challenge we have is capacity, and then clinicians will start to prioritise things. So when we did our expert panel on looking at implementation, we costed up all of those things to see what it would cost the state and tried to look at solutions not just in drug provision, but also in clinical provision and in testing, etc.
Thank you. And Rosalind, you will be very short.
I'm going to be I am short already, and my question will be short. Thank you, Henning. I'm Rosalind. I'm from UNAIDS, so I work a lot with Yanis. I have a question. Did you really use cost-effectiveness data as an argument? Because my understanding, cost-effectiveness is used to compare between two things that work, for example, and I get a bit alarmed about that because then you get into competition between cancer treatment for children, for example. Or did you use cost-benefit, for example, and the wider benefit, or did you use an argument about unregulated services will bring resistance and problems? How did you actually use pricing and services?
Maybe the Belgium would, because you had a game minister, that doesn't count.
I'm not sure if I can answer your question. There was one study done by the University of Leuven, and it was cost effectivity in such that it calculated from where the gain in the drop in new infections and the cost that would give. That was equaled with the rising cost of PrEP, and when PrEP would actually start paying itself back in less infections and so less care and less cost of care. Capacity was not taken into that account.
So the very last and very short question, thanks.
It's going to be complicated, but it's all right. It can be answered later on. My name is Winnie Seruma, and I work with PrEPster. I just want to ask about migrant communities. From the presentations this morning, it's clear there are themes developing and who accesses PrEP and who's not accessing PrEP. Considering there is a migrant crisis happening on the shores of Europe, what are the laws governing access to healthcare, therefore access to PrEP, those who can, who want it in your different countries, and what can we do about that so that people can be able to access PrEP?
I can only allow one answer, but we will have a session later on. I think this will be a really important theme throughout the meeting. Who wants to go on that? Daniela, maybe?
We have only a very negative answers since our governments of the north are restricting access to health for migrants. So there is no tips of things that are moving forward to provide more access to migrants and even less for PrEP. So,
well, it just proves that this is an issue, so we will take it up also later. Thank you. Now, we will have to break up for coffee now, I'm told, so go ahead. And Gus, how long time do we have for that?
I think we'll stick to our 15 minutes. We're 10 minutes late, but that's okay. Just really discipline yourself about the questions. There will be much more time to ask questions later on, especially tomorrow when we have the breakout sessions. So enjoy.
For your kind attention so far, and we know that there have been some minor technical defects and internet broke down and stuff, but please bear with us for the next part of the afternoon when we will be talking about actual challenges and additional possibilities to roll out PrEP across Europe, and the live feed will continue. Now we have a coffee break here, and then we will be back with you in about 15 minutes from now. See you then.